Hi everybody. So September is Pain Awareness Month, and I wanted to talk to people about one condition that causes the most amount of pain of all the arthritic conditions that I treat, and that is gout. And so I'm going to talk to you about 3 medications that are typically used to treat the gout and kind of how they work. So there are kind of 3 major groups of medications that I use to treat gout, and we'll talk about them real quick. My name is Dr. Arinola Dada. I help people with joint pain become pain-free, and people with autoimmune disease or gout get their immune system back on track and get rid of that uric acid. Okay, so we're talking about pain, gout. A lot of people have questions about the medications, right? One question we get often is, do I have to be on the medication for the rest of my life? And so I tell my patients, you're on the medication until the next best thing comes along, right? Your body is making too much uric acid and you cannot clear it. And because you can't clear it, the uric acid accumulates in your joints. It could be that you can't clear it because maybe your kidneys are not working that well. And so when you have a gout attack, your doctor considers your gout in 3 different phases. One is the acute problem, which is, I feel like my foot got smashed with a hammer. And how does your doctor treat that? Acute. Then the other time is when things are quiet. You're not having the acute pain, but you and your doctor are trying to come up with a plan so that you don't get another attack again, right? I had a patient came into my office. He'd been off work for a week because of his gout attack. That is impacting his quality of life. That is impacting his ability to provide for his family. So for this patient, what we would do is, one, we have a set of medications that we use to get rid of the pain. And so those include things like anti-inflammatory medications. I personally do not use anti-inflammatory medications for my patients with gout because most of them have already tried it. They've already tried it. They probably to some degree may have altered their kidney function. And so I don't treat with anti-inflammatory medications typically for the acute pain. Typically I use steroids. So whether we're using steroids as pills or steroids as injections into that joint. And then thirdly, we use a medication called colchicine. And the medication called colchicine, I tell patients what it does is that it prevents the inflammatory attack. It prevents the acute storm, right? So when you have a gout attack, what's really happening is that you have the crystals in your joints, and they're moving, and your body says, well, why are there crystals in my joints and what is moving? And it sends its soldiers, the white cells, into the area, and that is what causes that pain. It's really the inflammation that's causing the pain. That's why the steroids work. That's why anti-inflammatory medications work. And that's why a medication called colchicine works, because it helps to calm down the white cells that are causing the storm, right? So that's acute. And then chronic, in between attacks, your doctor really wants to put you on a medication primarily to prevent your body from making any more uric acid. So one of those medications is called allopurinol. Your doctor may do some tests to make sure you can tolerate the medication. Another medication is called Uloric. Again, that stops your body from making any more uric acid. And then finally, if you have severe gout where you have lumps of tophi on your elbows, that's kind of the last phase where it's more chronic, and you have these lumps of tophi on your elbows, on your ears. For people with that severity, there's a medication. It's an intravenous medicine, goes through your veins, called Cristexa, and it actually melts away the tophi. So if you have gout, there's one no shame. It's not an old man's disease, actually a condition that can happen even in young men and sometimes women when they're older, and usually this condition can be treated so that you can get your quality of life back. So if you know anyone that has gout, or you think this video has been helpful, please share it. Like us on our YouTube video, Healthy Joints, Healthy Life with Dr. Dada, or find us at overlakearthritis.com. We have a team ready to help you on your journey to a healthier you. Take good care.